So pregnancy is an amazing part of any woman's life. A woman who's pregnant looks forward to meeting their baby and thinking about the future for that person as they join their family. Elizabeth Garrett Anderson, shown here, was a pioneering feminist, a wife and a mother. As she was the first Englishwoman to qualify as a doctor and a surgeon. She lived locally to UCL, she worked locally to UCL, and she started the first hospital for women run by women in 1872. Now, in those days, having a baby was a very dangerous time, possibly the most dangerous time of your life. These days, medical profession, midwives have really helped to improve care for women while they're pregnant. But even so, to this day, there are some problems that we simply can't treat. And one of these is genetic diseases in the baby. So the baby has a problem with its genetic code. And we are, at the moment, unable to treat the baby. So one of the problems is this is actually much more common than you might think. So it's estimated about 2 to 3 out of every 100 babies born worldwide today has a problem, a genetic problem. And it's much more common in some communities, for instance, those communities where there's intermarriage, where cousins marry within families. It can even be up to 10% of those pregnancies. One of these diseases is brittle bone disease. This is a disease that's very severe in the baby. And you can see here, on the left-hand side is a scan picture of a normal thigh bone of a baby. And women commonly have scans in pregnancy. In mid-pregnancy, we have a look at the baby and see if the baby looks normal. And the scan on the left is of a normal thigh bone. But on the right is a thigh bone of a baby with this brittle bone disease, something called osteogenesis imperfecta. In this condition, there's an abnormality of the bone formation itself, and this causes the bones to be fractured, and you can see the little bend there is in the bone here. So this problem has already occurred in the baby before birth. There's no treatment. There's nothing that I can offer this woman and her family if she's found to have a baby with a genetic disease like this. Imagine if you are told that your baby has a genetic disease. How would you feel about that? Well, you'd probably be thinking, medical profession, you can come up with an option. But as a fetal medicine specialist and as an obstetrician, it's really an incredibly frustrating specialty to work in, because most of the time I have to say, I'm really sorry, there's nothing I can do for your baby. So what are the options available to women? Well, currently the only option is either to accept a baby that has an abnormality, to welcome that baby to your family, or in some countries and some societies, there is the option of terminating the pregnancy. For many societies and for many women and their families, this is simply not an acceptable option. But what about if we had a third option, treating your baby before birth? What would we need to have in place to be able to achieve this? Well, first of all, you need to make a very accurate diagnosis of the problem early on in pregnancy, so you can really get to the bottom of this disease, you can prevent it early on in life. And secondly, your treatment needs to be perfectly safe and really effective. So, is there anything that we can do to treat babies before birth? Well, we can first of all, currently, the methods of making a diagnosis of a baby with a problem are an invasive test. Many of you will have heard about amniocentesis. So what would happen is a woman would go along for her ultrasound scan in mid-pregnancy, and that scan would be done by somebody like myself, a fetal medicine specialist, and I would go, I think there's a problem with your baby. And I would talk to the parents and I'd say, look, I think there's a problem with your baby, I'm suspecting there's an issue here. We need to do a test to find out if there's a problem. And the test that we can offer at the moment is an amniocentesis, for example. In this scan picture, you can see there's a needle going in through the wall of the womb under ultrasound guidance, and the needle goes into the fluid around the baby, and we take a sample of the fluid, and in those fluid are cells that are shed from the skin of the baby, and we can do a diagnostic genetic test on those cells, which will tell us if the baby has the problem. So, these tests are really common. They're done hundreds of thousands of times in many hospitals around the world. But there is a problem. And that problem is that out of every 100 amniocentesis that we do, one baby is miscarried. So, is there anything we can do about this? Well, there has been a breakthrough in genetic testing that I'm going to tell you about. So there is something called free fetal DNA. This is simply the DNA from the baby's genetic material that passes across the placenta and into the mother's blood. So instead of having to do an amniocentesis and risking the pregnancy, we can now take blood from the mother at 8 to 10 weeks of pregnancy, a quarter of the way through gestation. And we can identify the baby's genetic material in her blood, and we can do a test and tell her whether her baby has got the problem that we might suspect. We can even do this test before we even think that there's a problem. And this free fetal DNA test was initially, the fetal DNA was identified only back in 1997. 15 years later, in 2012, scientists were able to entirely sequence the fetal genome. So they could tell the whole sequence of the genes of a baby from the mother's blood. So it's taken 15 years from initially finding this test to be able to telling us about the whole of the genetic material of a baby. And this test is currently being used in clinics just up the road to diagnose some genetic conditions. So we've got a test that we can use to diagnose things very accurately. Is there any treatment that we might be able to use? So if you want to treat a genetic disease, you need to be able to provide the correct protein in the correct cells. So one way is to use something called gene therapy. Gene therapy is a type of molecular medicine. What this does is it uses a vector to introduce the right genetic material into the right cell. The genetic material is then expressed, it produces the protein, and the protein then cures the disease. Now, the variety of different vectors that you can use viruses that have been modified to become safe, or you can use the DNA itself. With viruses have been inserting genetic material into our cells for millennia. They do this very safely if we modify them, and gene therapy vectors are currently being used in clinics near here to treat diseases like immune system problems and clotting problems. So scientists have now shown that you can treat genetic diseases in animals that are affected by doing fetal gene therapy to the fetus before the fetus is born. So an example of this would be a congenital liver disease like mucopolysaccharidosis. This is a very long word which basically describes an abnormality of the liver. It's a defect in the way the liver metabolizes some proteins. And the problem with this condition is that you get an excess in toxins that circulate around your body. They get through to the brain and they cause brain damage. And this brain damage occurs before birth. So even if you pick up that the baby has got the condition after birth, there's still not much you can do about it. This baby has brain damage. But imagine if you could apply gene therapy to the fetus, having made a diagnosis using the mother's blood at 8 to 10 weeks of pregnancy. And scientists have already shown in animal models that it's possible to cure this disease before birth using fetal gene therapy. An alternative approach is in utero stem cell transplantation. So stem cells are cells that are available in all our bodies, and they can turn into any different type of cell, a bone cell, a liver cell, a brain cell. And we can use stem cells from adults or children, and we can give them to the fetus, and we can correct genetic diseases. But the problem with these stem cells is that the fetus sometimes rejects them. So work in my laboratory has shown that you can take stem cells from the fluid around the baby, you can then correct the gene in these stem cells, and you can put those gene-corrected stem cells back into the fetus. And this causes expression of the right proteins and could potentially be used to treat genetic diseases before birth. So we're going to be able to diagnose genetic disease very early in the pregnancy. And gene therapy and stem cell transplantation are technologies that we'll be able to harness to actually treat the genetic diseases. And it's important that we're going to be able to offer parents an option, a third option, because I would rather offer something to a mother and say, we have a third option, this is a treatment. It's only taken 15 years to get from finding free fetal DNA to making diagnosis of the entire fetal genome. Perhaps in the next 20 years we might be able to use prenatal therapy to treat genetic disease and to give parents the really important third option of treating disease in their babies before birth.